Good afternoon. I would like to thank and welcome everyone for joining us for our overview of federal employee insurance benefits webcast for agency benefits officers. This webcast is brought to you by the United States Office of Personnel Management. My name is Wen Fu, and I'm with the Office of Planning and Policy Analysis, and I'm here with my colleague Ed DeHardy from the Office of Healthcare and Insurance. There will be 3 panels to discuss our initiatives in health insurance, dental and vision, life insurance, long-term care, and flexible spending accounts. The first panel will discuss policy and Medicare. The second panel will discuss flexible spending accounts, FSA Feds, dental and vision, FedVIP, long-term care, FLTCIP, and life insurance, FEGLI. Our third and final panel will discuss elimination of guides, family audits, and Self+1. We will answer any questions you may have at the end of each panel. We hope this can help you with any questions you may get from your current or future employees. You may email those questions to benefits@opm.gov. Again, that's benefits@opm.gov. Today, I'm very excited to share with you just a few of the great things that the OPM team has been working on in the past year. It's only April, but it's been a tremendous year, and we are extremely busy here, and I'm proud to tell you all about the few things that we've been working on. The next 2 slides will show you regulations that we have recently published, and we will discuss the new changes in depth in each panel. They are expanding FEHB coverage, Self+1 enrollment, enrollment options following the termination of a plan or plan option, and pathways to eligibility. To follow up, we also will be talking about FedVIP regulations, qualifying life events amendments, the eligibility for pathways to participate in FedVIP, FEGLI regulations, option C coverage for children of same-sex domestic partners, eligibility for pathways participants. And last but not least, FLTCIP, which is our long-term care, and eligibility changes to include the qualified relative as a definition for purpose of domestic partners. First, I will talk about a little more in depth about expanding our FEHB program. One of the priorities we have at OPM is to recruit, retain, and honor a world-class workforce for the American people. We are proud to take the lead to make the federal government America's model employer for the 21st century. We all know that nothing is more important than you and your family's health. Now, with this initiative, many current and new federal employees will have access to affordable, quality healthcare coverage for themselves and their families. So we published a regulation on October 17, 2014, that expanded coverage of our healthcare to seasonal, temporary, and intermittent employees. And it became effective November 17th of 2014. One way we believe that we can recruit and keep the best and brightest is by expanding our FEHB coverage to cover more employees, including the new temporary, seasonal, and intermittents. So now, all seasonal, temporary, and intermittent employees who are expected to work 130 hours per month or more for at least 90 days will be eligible to enroll in FEHB. And the best part is that they will have a full government contribution. I know that this is a big change, and we here at OPM team will be glad to assist you with any questions you may have. Here are some of the websites that you can visit for more information, including regulations and the Benefits Administration letter that we sent out in late 2014. If you have any other questions after reading this, please feel free to contact us. We'll be glad to help you with anything you may have. Next, I would like to talk about our Pathways program. This program was created by Executive Order 135062 and signed by the President into law on December 27, 2010. This was passed to express the value that the federal government places on recruiting and retaining students and recent college graduates for public service careers. We published our Pathways eligibility regulations in January of that year, and it became effective in February. Today, the federal government is competing with many private employers to recruit recent graduates, especially in the STEM fields. To help recruit these graduates, we want to let them know that if they decide to pursue a career in public service, they will have a great healthcare program that will take care of both them and their families. To make it even better for those recent graduates, we decided to include dental and vision, FedVip, and also life insurance, FEGLI. My last topic will be enrollment options following the termination of a plan or plan option. Us at OPM want to make sure that people stay covered. If a plan terminates, generally enrollees have 60 days to enroll in a new plan. We sometimes know that people's lives can get busy and they might forget. So we want agencies to have the ability to make sure that their employees stayed enrolled in FEHB. So what does this regulation do? The agency can now enroll the employee in the lowest cost nationwide plan option that is not a HDHP, which is a high deductible health plan, nor have a membership fee. Now, these are just some of the great things that we've been working on. Later, my colleagues will go more in depth and more detail about some of the things I mentioned before. I would like to thank everyone for attending this webcast, and I truly believe that with our great benefits, we can continue to make the federal government a great place to work for both current and our future employees. Now, I'd like to turn this panel over to my colleague, Ed DeHardy, who will talk to you about Medicare. Thank you.
Thank you, everybody. Thank you, everybody, for coming out. I'm going to talk to you about our recent policy initiative with regard to Medicare and what we're asking our FEHB carriers to do and how that will impact the options that are available to federal employees and what guidance you might be able to give the federal employees based on this new initiative. We put together a panel in healthcare and insurance to evaluate Medicare and our interaction with Medicare, fairly much new. We decided not to look at it with preconceptions, but to evaluate what data we have, especially with regard to how it impacts enrollment and newly eligible Medicare FEHB annuitants. So the panel that we put together included several OPM actuaries. It included groups from our policy, employees from our policy group. It included people with backgrounds in economics and statistics, and we looked at all of the data that we had on Medicare. As a preliminary thing that we looked at was what is our current enrollment. And for Medicare Part A, as it shows on the slide, we have 96% eligible enrolled. And this is kind of a no-brainer for the modern federal employee. They're paying into Social Security, they're paying into Medicare for Parts A, and they receive it free when they turn age 65. At the moment that they begin receiving their Social Security benefits, they must get their free Medicare Part A, and they may not refuse Part A. It's automatic, and to refuse it, they would have to disavow all of their Social Security benefits and elect not to receive Social Security benefits. So we don't have a large problem with respect to Part A. For Part B, however, we only have 79% enrolled, and there's been a long-standing guidance that's come out of OPM and then out of the benefit officers at the local federal agencies. People ask, should I enroll in Medicare Part B, or should I refuse that enrollment and to pay that supplemental premium? And for years we've been saying, in some plans, maybe it might be in your best interest to enroll, but in other plans, it might be in your best interest just to stay with what you have. Notably, if you're in an HMO, you probably don't need Medicare Part B. And that's kind of been our message, and that's what we're trying to change. So under our current status quo, as it says in the slide, Newly eligible members are refusing Part B at an increasing rate. And also, we noted that we might currently have less than optimal coordination with Part B drugs. Other aspects of Medicare are obviously Medicare Part C and then Medicare Part D. For Medicare Part C, FEHB members may suspend their FEHB program enrollment to enroll in Medicare Advantage. Members in some areas may enroll with FEHB cover serving as a wrap. And there's certain plans, notably Kaiser offers Senior Advantage in the regions where they offer their plan. And for that, members can enroll in Medicare Part B. They can elect not to refuse their enrollment. Then they can choose to enroll in the Senior Advantage plan that's offered by Kaiser. And that plan integrates with the FEHB coverage. I'm calling that one plan out, but there are other plans. And we've asked our FEHB plans to evaluate their plans with regard to the coordination with Medicare Part C to explore whether they can offer a benefit like that, and if they can, to perhaps make that available during the next upcoming open season. For Medicare Part D, there is currently little incentive for FEHB program members to enroll in Part D, and little emphasis has been placed on coordination. Members have historically been told Medicare Part D is unnecessary. That's likely not to change during this next open season, and our policy activity during our upcoming negotiation is primarily going to be aimed at Medicare Part B. So this just to highlight all of the aspects of Medicare. Okay, so our panel evaluated the status quo as I just outlined it, and then we said, well, what are the problems with the status quo? The problems are notably that the rising costs are unsustainable. There are things coming down the pike with regard to the Affordable Care Act, such as the excise tax, that are adding to these issues. And we need to look every way that we possibly can to control costs or mitigate cost. There are additional savings available through Medicare coordination. We need to make sure that we are doing the best that we can to leverage that coordination. The graph that I just pulled up here shows graphically what I've said heretofore. And if you look at the lines, the top line is newly eligible in the fee-for-service plans, and you notice that that is really diving. The lower line are in HMO plans. I believe I did that right. I have several slides on this. But the bottom line is our newly eligibles, the rate of the enrollment is decreasing. And the big takeaway from our study was that that rate seems more correlated to the message than anything else. Not the underlying value, but the actual message. So we want to make sure that the message is accurate, and the message indicates that in all likelihood, it's in everyone's best interest, including the member enrolling, that they enroll in Medicare Part B when they are first eligible. So as we sit here now, in most instances, that is the case. That's likely the case. It's likely in the enrollee's best interest to enroll in Medicare in the aggregate. But there are plans, and there may be plans, where it might not be in an enrollee's best case. So during our upcoming negotiation cycle, we're going to change that. We've asked our FEHB plans to come in with proposals to both provide education to the members, showing the underlying value that they can provide, and where they notice gaps or they don't think they're providing value, we want them to provide proposals that add that value. If you look in the FEHB call letter that we send out as our negotiation objective to our plans every year, the call letter highlights that we want cost neutrality in all benefits. If they offer any incentive or any new benefit, we want a corresponding decrease so there's cost neutrality. That's not the case for this Medicare proposal. We're allowing them to add benefits with regard to Medicare coordination that may even add cost on the front end with regard to the premium, because that's how important this is to us during our negotiation. So our strategy, which I've pretty much outlined, is we want to provide lower cost sharing for those that are enrolled in Medicare. We want to promote the value to newly Medicare eligible FEHB members, and we want to maximize our coordination with Part B covered drugs. So the largest part that we need the benefit officers to do is to change the message to match the reality. And here in the slide, I've said the new reality. The reality is already that for most members, it's likely in their best interest to enroll in Medicare Part B. And people, might think, well, I'm pretty healthy and I'm going to be pretty healthy. None of us are going to be pretty healthy as we get to advanced age. And at some point, there's always going to be a time when you're going to need the coverage and the additional coverage. And in the aggregate now, it's in people's best interest to enroll in Medicare. But at the individual level, it's likely in their best interest as well. So the benefit officers are integral to this effort. And the bottom line is that Medicare-eligible annuitants should choose Part B when they are first eligible. You may contact me if you have issues or questions with this at the phone number shown there, or better probably, to reach me at edward.dhardy@opm.gov. And Wynn and I are going to be up here for a couple minutes to take any questions. First, do we have any questions here in the auditorium?
Okay, so we had a question regarding the plan termination option. The question is it up to the agency to determine if they want to enroll an employee in FEHB when the plan terminates? Generally, the individual has 60 days to select a new plan if a plan terminates or if the plan option terminates. We're just giving the agency the option to enroll these people who forget to enroll or choose not to enroll, to enroll them in a nationwide plan that's not a HDHP or has a membership fee. We have another question regarding the newly eligibles for FEHB. The question is, how would these newly eligible employees be identified? It is generally identified by the employing agency. They will make a prospective determination at the time of the hire if the employee is going to be projected to be working 90 days and above 130 hours. If the agency determines that, then they can inform the employee that they'll be eligible for FEHB with a full government contribution.
I have a question here. We have a question from somebody at an agency. In your discussion on FEHB enrollees enrolling in Medicare, are you only talking about those who are annuitants? For instance, if we have an employee who is 72 years old, do you want them to enroll even though they are still employed with us? If they're employed such that they will not receive a penalty when they retire and enroll in Medicare Part B, it might not be necessary with regard to this initiative that they enroll. That would be similar to our old advice that they want to evaluate what's in their best interest. For active employed people where FEHB is primary, the cost concern is not as great for the individual or for the whole program at large. Nevertheless, there's no reason why a person situated that way would not want to actively consider currently enrolling in Medicare Part B, and it may be in their best interest. At the point, though, when they leave federal service, it would definitely be in their best interest to pick up Medicare Part B.
We have another question regarding part-time employees. Question is, are part-time employees covered by this new expansion of FEHB eligibility? The part-time employees are regulated by the Part-Time Career Act. Under the Part-Time Career Act, their FEHB contribution is prorated based on the number of hours of work. They can range from 16 to 32 hours. And the Part-Time Career Act explicitly excludes temporary and intermittents, so those employees will not be prorated.
I have a question here. Should the employee cancel FEHB coverage and enroll under Medicare Part A, or suspend the FEHB coverage and enroll in Medicare Part A? The employee should, or the annuitant should enroll in Medicare Part A. That will coordinate with their FEHB coverage. They do not, at that point, suspend their FEHB coverage. And if they're not going to enroll in a Medicare Part C plan, they may not suspend their FEHB coverage and come back in solely because they have Part A. I have one other question here. Someone said, are you suggesting that annuitants continue FEHB and also pick up a Medicare Part C plan? If they're in an area where a Medicare Part C plan is offered that does coordinate with their FEHB coverage, that is an option they should actively explore. Otherwise, they can explore looking at Medicare Part C and suspending their FEHB coverage, but that's not part of our current initiative. I think we're going to move on now to the next panel. And do you have the information on that?
Yes.
Dave Johnston is coming up, and he's got a couple other people to talk about the FEHB program issues that Wynn highlighted in his opening. Thank you, Dave.
Thank you, guys. Good afternoon. My name is Dave Johnston, and today myself and my colleagues are going to be talking about the non-health insurance programs that are offered by OPM for federal employees. I'm going to begin by talking about the Flexible Spending Account Program, FSA Feds. Then I'm going to pass things along to Connie Delormier, seated next to me. She's going to tell you about the Dental and Vision Insurance Program, FedVIP. And then we're going to go to Kathleen Healy at the end and talk about the Long-Term Care Insurance Program, FELTSIP. And then we're going to come back to me to talk about the Life Insurance Program, FEGLI. So let's get started first with the Flexible Spending Account Program, FSA Feds. Now, the most likely question that you're going to be asked as a benefit officer in the coming months is about carryover, because that's brand new for this year. Question could be, what is carryover? Now, this is applicable to employees who are enrolled in a healthcare or limited expense healthcare flexible spending account for the 2015 benefit period right now. For these employees, you can carry over up to $500 of unspent funds from your 2015 healthcare flexible spending account into another healthcare or limited expense healthcare flexible spending account in 2016. Up to $500 of carryover, that's brand new. How do you qualify? There's 3 important rules on who qualifies to use carryover. Number 1, you must remember to actively re-enroll in a healthcare or limited expense flexible spending account for 2016. Re-enrollment for this program is not automatic. Your employee has to remember to re-enroll in another account next year. Second requirement for qualifying, you must make all of your FSA payroll contributions throughout 2015. So if you go on a leave without pay, you need to accelerate your payroll deductions ahead of time or catch up after the fact. Third requirement, you must be employed by an FSA Feds participating agency throughout 2015 to use carryover. Another question you might be faced is, what about the grace period that people are used to having with the healthcare flexible spending account? So for healthcare and limited expense accounts, there is no more grace period. You have from January 1st, 2015 through December 31st, 2015 to incur these eligible healthcare, dental, vision expenses. Now, you can file claims on those expenses, submit your receipts between January 1st, 2015 and April 30th of 2016. So that deadline for submitting receipts, April 30th, has not changed. You also get carryover if you meet those 3 requirements that I just talked about, but there is no grace period at the beginning of 2016 where you can still incur eligible expenses against your 2015 balance. For dependent care accounts, you do still get the grace period. So if your employee is enrolled in a dependent care flexible spending account, they have from January 1st, 2015 through March 15th, 2016 to incur eligible expenses against their 2015 balance. Notice that extra 2.5 months at the start of 2016. They have, just like with the other account, from January 1st, 2015 to April 30th, 2016 to file claims on those eligible expenses. Now, the January 1st, 2016 to March 15th, 2016, that 2.5-month grace period only is available if you meet certain requirements, and those are similar requirements to carryover, where you have to make all of your payroll contributions and be employed by an agency that participates in FSA Feds throughout 2015. But there is no re-enrollment requirement to use carryover with the dependent care account. Unfortunately, dependent care FSAs are not eligible for carryover by law. So they do get the grace period, but dependent care accounts do not get carryover. What if I do not meet those requirements? So if you're in a healthcare account and you don't meet all 3 of those requirements, you can only incur eligible expenses through December 31st, 2015, or when you stopped being eligible. I'm sorry, this is for dependent care accounts. If you don't meet the requirements, you don't get the grace period. You can only incur eligible expenses through December 31st or when you stopped being eligible. But you do still have until April 30th of 2016 to submit those claims. Now, how do I use these carryover funds? Carryover funds will be available by January 15th of 2016 to use. You can use them on eligible 2015 expenses that you submit by April 30th of 2016, or you could use them for your eligible 2016 expenses all year long. You can carry over the same funds year after year, but you must elect a minimum of $100 each year, and you cannot carry over more than $500 in a single year. What happens, another question that you might be asked, what happens if it's December 31st, 2015, and I have more than $500 left unspent in my healthcare flexible spending account? Well, you're going to want to incur some eligible expenses on that last day because you do have until April 30th to file your claims, but all of your eligible expenses above $500 would be forfeited, all of your account balance would be forfeited outside of the carryover threshold if you don't have eligible expenses incurred in 2015. Any funds not carried over and not reimbursed through a timely claim will be forfeited. So encourage all of your employees with a healthcare account to spend down their balance to $500 or less by December 31st, 2015. If you have any questions about any of the programs that we're about to talk about, you can email them to benefits@opm.gov, and we'll answer some of your questions at the end. For now, I'm going to turn things over to Connie.
Thank you. All right, so today I'm going to talk about what's become one of the hotter topics of FEDVIP, and that is having your incapable of self-support dependents certified so that they can be continued under your plan, your dental or your vision plan. Whenever possible, OPM's employee benefit programs extend eligibility to enrollees' adult children that are incapable of self-support, and that, of course, is also true with FEDVIP. Agency and retirement offices are responsible for the certification, and once certified, a letter generally remains in the personnel or the annuitant file and should be used for other programs as the needs arise. As always, the disability must have begun while the person was still an eligible dependent. And with the exception of age and marital status, all of the requirements are the same for every program that offers extended benefits like this. However, as we all know, the Affordable Care Act relatively recently, changed the eligibility age for FEHB to 26 and also allowed dependents of enrollees to be married and still covered up to the age of 26. But for all other, including FEDVIP, which is what we're here to talk about today, FEDVIP was not affected by the Affordable Care Act, and these dependents still must be single and still must be certified at age 22 in order to continue as eligible family members. Because of the dependent age, FEDVIP enrollees now have to go seek out this certification themselves. In the past, we've always just accepted the FEHB certification, and in some occasional instances, people would be certified by their carrier. However, now that the FEHB certification is no longer available to these folks when their children turn 22, they have to go and find this themselves, for the FEDVIP. There is one additional step required for FEDVIP, and that is, since Benefeds administers the FEDVIP program, they're the ones that notify every carrier, who is eligible, who's not. So you need to pass this eligibility status to BeneFeds so that they may continue to let all the carriers know when they have an enrollee that is incapable of self-support or a dependent with incapable of self-support at age 22. And FedVIP enrollees are more likely to drop out of a program, re-enroll a year or two later, or switch carriers. That's why it's important that the employing office does this rather than the carrier, because this way the person only has to go through the process one time rather than numerous times, depending on how many times they may or may not jump in and out of coverage or switch carriers. We put out a BAL in October of 2013 that provided guidance on how to notify BeneFeds and how to follow this process. This BAL gives directions about sending the notification by email to, oops, I'm sorry, I forgot to change the slide, to FedVIP administration at ltcpartners.com. This is a special mailbox. It's only used for certifying dependents. So once they get that, they take care of it, and they will respond to you, letting you know that that person has been noted, and hopefully the enrollee doesn't have any problems after that. Some people found this BAL to be a bit unclear, so we put out a clarifying listserv in January of this year. Now, I don't know if it was unclear, but it didn't really, everybody seems to want to send paperwork and things like that along with the certification. However, BeneFeds is fully automated. They don't hold account files. That's what the personnel files are for. They don't keep this information. They just note the file. It's electronically noted. And as long as the code is in there, it's in there. They don't need the backup documentation. So what you need to send, there's 3 pieces of information that the employing office needs to send, and it generally, we'd like it to come on an email from work that has a signature from an HR office on it. The 3 pieces are, number 1, the enrollee's name. The second piece, of course, is the dependent's name, and then the third piece is the status of the disability. Ordinarily, that's going to probably be permanent, but there are occasions when someone will have some type of a disability that they are capable of recovering from, and then you'll have an expiration date that is set in there by, you know, whatever the doctor has said in the documentation you used. That is pretty much all I have on this subject. So I will pass the baton here to Kathleen, and she will tell you about FLTCIP.
Good afternoon. The last program we're going to talk about at this panel is Federal Long-Term Care Insurance Program. OPM offers long-term care insurance with the Federal Long-Term Care Insurance Program that we call FLTCIP. When you can no longer perform everyday tasks for yourself, such as eating, dressing, or bathing because of a chronic illness or a disability, long-term care insurance can help you pay for the help that you need. It's not something that most of us want to think about, but most people will need this kind of care at some point in their lives. But health insurance and Medicare usually provide little or no coverage. FLTCIP differs from the other insurance programs that we're talking about here today. For this program, each person applies separately to the program, and you must pass medical underwriting to enroll in FLTCIP. Underwriting, it's a process of reviewing an applicant's health to see if he or she qualifies for coverage. Employees and their spouses have 60 days to apply with abbreviated underwriting, and that means that they are answering less questions. It's important to note that long-term care insurance isn't just for you. Your spouse, adult children, Parents and parents-in-law are all eligible to apply. In fact, they can apply even if you don't, because as I mentioned before, each applicant is applying on his or her own and must answer health questions to be approved before they can enroll. For FELTSIP, you and your eligible family members can apply at any time with full underwriting. On the website, ltcfeds.com, we have a lot of information about long-term care insurance. You can view the costs in your area for long-term care costs, such as having a home health aide come to your home, or what it would cost in an assisted living facility. And you can even get a rate quote based upon your current age for FELTSIP. We have an interactive online consultant tool. You can listen to podcasts. There's a lot of information on there that we encourage you to take a look. And we also have our new spring webinar series. You can go on there and sign up to watch archive ones that have in the past, or future ones that will be coming up in the next month or two. And for our agency benefits officers, ltcfeds.com/ABO is a dedicated page for agency benefits officers. So it provides information and tools you need to help educate your employees on this important benefit. There's various webinars that you can use for your new and newly eligible employees, and 2 versions, a 15-minute version or a 30-minute version. You can determine what works best with your new employee orientation. Other resources on there for FELTSIP, training modules, podcasts, there's articles. Each agency, at Long-Term Care Partners, there is an account manager, and they work with the different agencies. If you're not sure who your account manager at Long-Term Care Partners is, you can find out by looking at the agency benefits officers page. The account manager is a great resource, and they can often do a presentation at your agency. You can also order materials for your eligible employees from the website. So we encourage you to check that out for agency benefits officers to help you educate your employees. Okay, now I believe we're going to be taking questions. Oh, I'm sorry, Fegley.
Yes, now we're going to be
Yes.
going to our final
sorry.
topic. Before we go to questions, I'm going to be talking about the Federal Employees Group Life Insurance Program, FEGLI. The most commonly asked question that you will get as a benefits officer is, when is the next FEGLI life insurance open season? The answer is none are currently scheduled, but please emphasize to your employees that you can do most of the FEGLI actions at any time. You can enroll or increase your coverage by providing satisfactory evidence of medical insurability at any time. The form for that is the standard form 2822. Part of the form is completed by the employee, part by you, the human resources officer, and part by their examining physician. And that can be done at any time. The one thing with that is that you cannot enroll or increase option C, family coverage, with a physical exam like that. You can cancel or reduce your life insurance coverage, again, at any time, using standard form 2817. And your employees can change their beneficiaries at any time, using standard form 2823 and submitting that to you. Contact your Human Resources office to take all of these FEGLI actions. You can also elect or increase your FEGLI life insurance coverage within 60 days after a FEGLI life event, again using standard form 2817. FEGLI has 4 life events. They are marriage, divorce, death of a spouse, or acquisition of an eligible child. If your employee has one of these, then within 60 days, they can elect any and all types of FEGLI coverage up to basic, option A, 5 multiples of option B, and 5 multiples of option C. This is an interesting one. You might get a question like this from your employee. It sounds something to the effect of, yikes, I got this letter or email from something that sounds official, warning me about skyrocketing FEGLI premiums and urging me to call this phone number or visit this website. Is this a real FEGLI communication? The answer is no. This is from a life insurance company that's trying to gain business from federal employees. As of the end of December last year, FEGLI is now a registered trademark of the United States government and OPM. This means that companies cannot use FEGLI in any way that would cause confusion with the real federal employees group life insurance program administered by MetLife. If you or your employees receive any such phone call, email, letter, please send them to us by emailing them to fegli@opm.gov, and we'll pass them along to our lawyers. Another question that you might be asked, this one is a two-parter, so I'm going to ask Kathleen to role play with me a little bit on this one. I will play the role of the employee, and she will play the role of the benefits officer. So I come to her and I say, I just got married, hooray! Or perhaps, my divorce just got final, at last. Or maybe, I just had a baby, I need a nap. Can you help me make changes to, let's say, my health insurance because of that?
Yes, I can. Do you also need to update your FEGLI designation?
I hadn't thought of that. So this is just something to remember, that whenever your employee comes to you with a life event, to change their health insurance, or maybe to change their SERS or FERS contribution beneficiary, just remind them, do you have FEGLI? Would you like to update your FEGLI beneficiaries while we're at it? So any sort of life event, marriage, divorce, birth, adoption, death of a family member, just remember FEGLI beneficiaries, because the employee might not remember to update that. As a reminder for FEGLI beneficiaries, your employee can name any beneficiaries that they choose, and that could include a trust. They can change those beneficiaries at any time. You don't have to wait for a life event, but that might be a good opportunity to do that. To change beneficiaries, submit Standard Form 2823 to your Human Resources Office. That is available on our website at opm.gov, but the easiest way I've found to get that form is to just put in a web search for SF2823. It's the first result to pop up is the PDF. Please periodically remind your employees to keep their beneficiaries current and where to submit the form. This is particularly important with some agencies that don't have local HR. People say, I have no idea where to send my designation form. So please make sure your employees understand that. Now we're going to turn to questions about any of these topics that we've just covered. First, to the folks here in the audience, does anybody have questions about any of the 4 insurance topics that we just covered? All right. I had a few questions in the inbox about flexible spending accounts. Pamela wanted to know if there was a way to discontinue automatic reimbursements. I believe she's referring to paperless reimbursements where her dental carrier, her dental insurance plan would submit claims directly to FSA Feds for her, and she would not be submitting those claims. The answer is yes, there is a way. You can cancel paperless reimbursement at any time. Just call up ADP, which is our FSA Feds contractor, or you can send them an email and ask them, tell them that you want to cancel paperless reimbursement. You can also do that online at any time. And when you do that, you'll submit your receipts manually from that point on, and you can control your rate of reimbursement. Carol wanted to know if you can carry over your healthcare flexible spending account funds into retirement. The answer is no. You are not eligible for FSA Feds as an annuitant. That is IRS law. So at the point that you retire, you've lost your ability to incur new eligible expenses. You can only incur eligible expenses while you are an active federal employee, and that includes carryover funds. Any questions on your programs?
I have one question for FEDVIP. I've been asked, can an existing certification for a child incapable of self-support since before age 22 be submitted to Benefeds now just to get it so coded by Benefeds? This would be for an employee who is not in FEDVIP now and never has been, but plans to enroll in 2017. Yes, what you need to remember, first of all, is you do not submit the certification. You simply send them the email that has the enrollee name, the dependent's name, and the status of the disability. Also, that's one of the reasons, once you do notify benefits of this status, this will remain with them. So if this person cancels the dental coverage for 3 years, comes back in 5 years, and enrolls again, they will still have this incapable of self-support child noted as eligible, because you register with benefits before you choose to enroll in any program that they administer. So that will stick with them if this person, once you send any certification allowing, acknowledging that this dependent is incapable of self-support and is eligible for the coverage. I hope I was clear.
So I've got a couple more, although there are some long-term care
Yeah,
questions
there are
in
a
there.
couple long-term care. People want to know if current annuitants are eligible to apply for long-term care. They are. They need to apply with full underwriting, and as a annuitant, you do not have to be enrolled in FE8 or eligible for FEHB. That is a requirement for employees. Someone was also asking about a parent. Your parent can apply even if they live overseas. And on the application, they are asked in what manner are they a qualified relative, so that it would be, if it was my parent, is because I'm a federal employee. So they have to show that they are a qualified relative in order to apply for the program.
So Beth asked, if an employee didn't start until after January 1st of this year, can they still use carryover? And I believe the answer to that is yes, but you need to verify that with the folks at FSA Feds, because we have new employees who start in February, March, April, the middle of the year. And as long as they still meet those 3 requirements for the term in which they are a new employee, then they can still use carryover. But do double check that with FSA Feds by giving them a call before you tell that to the employee. Jennifer wanted to know if FEGLI Option C will allow children to be covered past age 22 if they are incapable of self-support. Yes, your agency can certify children as incapable of self-support based on a physical or mental disability that existed before age 22, and then that child could be covered under FEGLI Option C beyond age 22. And that certification is done by you as the employing agency. Judy asked where to send those FEGLI communications from third-party companies that are masquerading as official FEGLI communications. Send those to fegli@opm.gov. Try to send us a copy of the communication, and we'll take it from there.
I have another one for long-term care. Can a former federal employee receive long-term care insurance? No. In order to apply, you need to be a current federal employee or a federal retiree, so it's not open to former federal employees.
April asked if OPM is accepting scanned or faxed designations of beneficiaries for the FEGLI Life Insurance Program. And Kathleen, you can correct me if I'm wrong, but I believe we still require wet ink signatures because there is a requirement in the regulations that the signature be witnessed by 2 people. Is that right?
I just want to clarify, at the agency, when you get it from your employee, it needs to be the original signature with the wet signatures. But at that point, when you add it to your electronic OPF, so the EOPF, it will then look like a scanned copy. When you send that to OPM at retirement or OFEGLI at death, you can send it from your EOPF, but we want the seal on there that said it's something like official copy from the EOPF to show that it was indeed in the employee's official personnel folder before they passed away or retired.
Okay, but when you get it from the employee, it has to be a wet signature.
Right, and then they
Okay.
can convert it.
Sandra asked me to clarify that you don't need to wait for a life insurance open season to enroll in FEGLI. And that is true as long as you either have one of those life events and enroll within 60 days, or if you pass a physical exam using standard form 2822, you can enroll in FEGLI outside of an open season.
I have one question regarding an employee that's leaving federal service. What is the last day that that employee can make a dental benefit and still be covered under the FEDVIP? That would be the last day of the pay period in which they're eligible. So if you have a 2-week pay period and that person is only working during the first week, they're still eligible for the whole 2 weeks. Can they continue that coverage? No. FEDVIP does not have temporary continuation of coverage or any grace period. So that's basically got to get it done before that pay period's over.
I have one from an employee asking if employees can access the agency benefits officers page on the long-term care website. I'm not 100% positive on that, but I'd encourage you just to go to the ltcfeds.com. We have a lot of education about what long-term care insurance is in general, plus the highlights and all the details of our program. And there's webinars about for current enrollees too, that there's plenty of information that's geared for prospective applicants, that the ones for the agency are a bit more for what they should do to help their employees learn more. So I think the regular page would actually be more helpful to you.
Donna asked a good question. She wanted to know, when requesting additional FEGLI through getting a physical exam, do you still have to wait 1 year from your last waiver of life insurance to make this request? And the answer is yes. So you can sign up outside of a life insurance open season through that physical exam, but 1 year, at least 1 year, must have passed since the last time you declined life insurance, either as a new employee or through a previous waiver, something like that.
Yeah, for another one for long-term care, someone saying, I'm not sure if I'm enrolled in FELTSIP, long-term care insurance. Can my HR office tell me? Actually, they can't, because we said the way the long-term care insurance program works is you apply and enroll with our contractor long-term care partners. So if you're thinking you might be enrolled, or if you just want to find out more, you can call them directly at 1-800-582-3337.
Sharon asked if there's a way to sign up for paperless reimbursement if you are covered by TRICARE. So paperless reimbursement is not tied to your health insurance program. If you are enrolled in FSA Feds and your FEHB health plan participates in paperless reimbursement, then you can use paperless reimbursement. But TRICARE does not participate in paperless reimbursement, if that's what you're asking. No, you would need to submit claims manually for out-of-pocket medical expenses that go through TRICARE.
Do we have time for one more?
I believe we have roughly 5 minutes.
I
No?
have a FEDVIP question, and it could be pretty interesting. When an employee retires and wants to enroll in FEDVIP because they are losing vision coverage with the agency, QLE, at retirement, is a new certification required at that time, or can they use the letter on file with the agency? First off, for most agencies, if you're eligible as an employee, you're eligible as a retiree for FEDVIP. The eligibility is not in question unless you work for an agency. You're not going to lose coverage, is what I'm saying. It's not a QLE to cancel or join the FEDVIP unless, of course, you're at an agency that has their own vision or dental plan and you are a member of that vision or dental plan and have never had the FEDVIP. in which case, when you retire, if you are losing that coverage, you may enroll in the FEDVIP. However, this question was asking to clarify the incapable of self-support. I just felt I should clarify that portion first. If you've never been enrolled in FEDVIP, but you have the certification because the child is enrolled with your medical benefits or some other program, then you would only have to have the notification sent to BeneFeds as you plan to do this. I would say go ahead and notify your agency and ask them to send it on your behalf to begin with, to make sure that they have this, because sometimes when we request it from retirement, just because they have so many other things to do, it takes a while. So that hopefully clarifies that, and it's all I have for FEDVIP right now.
Checking with our timekeeper, do we have time left? 2 minutes, okay. So I've got a couple of questions on FEGLI Life Insurance that sort of are similar, one from Minute and one from Steve. Minute wanted to know if FEGLI sends out notification letters to employees reminding them about family coverage and that children are covered until their 22nd birthday. So no, we don't send out letters like that, and there's a couple reasons. Number one is that for active employees, the custodian of your FEGLI life insurance records is your Human Resources Office, your agency. OPM does not have access to those life insurance records until after you've retired. And our contractor, MetLife, basically just pays claims. So they also do not have access to anyone's records until after their death. So as a human resources officer, it is your responsibility to remind your employees that Option C coverage, unless it's a child incapable of self-support, ends at age 22. And if you have no eligible family members, if you're divorced and your last child is turning 22, you should be canceling your Option C, because otherwise you're paying premiums for coverage and you don't have any family members. Option C is the one exception in our program where if you do pay premiums beyond the time in which you have eligible family members, your agency is required to reimburse you for those premiums when you had no spouse and no children under age 22. For other premium issues in FEGLI, there's generally no reimbursement rules. And Steve's question was similar. Does the 2823 designation form get mailed to OPM or FEGLI MetLife at any time before somebody dies or only after? And again, the Human Resources Office is the custodian of that record. Once the person retires, it goes to OPM, and once the person passes away, only then does it go to MetLife. Kathleen, did you have something?
Yeah. Someone's asking, what about a disabled sister or brother? Are they eligible for long-term care? No, it is, siblings are not a qualified relative under FELTSIP. And one of the other ones I had, if I'm a current enrollee, a current active employee, my parents and parents-in-law are eligible to apply. Someone said something that I can get long-term care for my parents. They can apply for coverage using the full underwriting application because you are a federal employee, but you are not applying on their behalf. Just want to make that clear.
All right, we are out of time. We're going to turn things now over to the FEHB panel to talk about several updates in the health insurance world. Thank you very much.
Good afternoon, everyone. My name is Amber Hudson, and here with me I have my colleagues Demi Mosian and Maria Bianchini. And today we are here to give you updates on the Federal Employees Health Benefits Program. I will be speaking about Self Plus One, and Demi will be speaking about Demi will be speaking about the elimination to the guides to federal benefits, and Maria will be speaking about the family member eligibility audit. So we'll start with Demi Mosian.
Okay. Oops, wrong way. Good afternoon, everyone. My name is Demi Mosian, and I'm here to talk to you about our decision to eliminate the Guide to Federal Benefits. We've been producing the guide for a long time, but on January 29th, we sent out an email to all headquarters agency benefits officers notifying you that we would no longer be producing the Guide to Federal Benefits. We expected a lot of comments and questions, but I only received a couple. We still wanted to take this opportunity to explain why we made this decision and what we plan to do instead. Well, it all started with the Self+1 enrollment type. Just adding the rates to the Guide to Federal Benefits meant a major revamp of the guide because of space limitations. So while we were researching the different possibilities, we decided to take a broader perspective and look at the guide itself. So we considered the cost of production. We have the cost of typesetting, printing, and the staff effort it takes to revise and produce the guide each year. We also considered that over the years, we are receiving less and less orders from agencies for printed guides. And in fact, some agencies have stopped ordering printed guides altogether. We also wanted to avoid the almost inevitable errors that occur each year with the guide. We work really hard to catch all of the errors, but some always slip through. For example, there could be something wrong with one of the headers, or there could be some misinformation in the benefit fields. Once it's printed, we can't correct it. And then we have information out there that conflicts with the correct information that's on our website. So we decided to go along with the the government-wide initiative to go green and eliminate the guide altogether. But we also realized that almost everything in the guide is already online. For example, we have our plan information pages, we have our premium charts, we have our online plan comparison tool, we have tons of FAQs, as well as informational sections on enrollment, how to enroll, and eligibility. But don't worry, we have a plan to provide information in lieu of the guide. We have assembled a team that will identify any information that's in the guide but not easily found on the website. And then we're going to adjust the website navigation to make everything easier to find. We're also going to create some new printable materials. I'm sure you've seen some of our materials called Fast Facts. These are documents that are about 1 to 2 pages and are on specific topics. We have Fast Facts on things like what to consider during open season, FSA feds, thinking about retiring. We actually have Fast Facts on over 30 different topics right now. And we're going to create a couple more. We're going to create one on the Temporary Continuation of Coverage, or TCC, and we'll create one on the Spouse Equity Act, or coverage for former spouses. We also have a plan to create a printable plan list, something that your employee can print that's by state. We're still working out the details on this, but the idea is that someone can select their state, then select what kind of employee type they are or rate type they're looking for. For example, they'd select whether they were a annuitant or maybe a TCC enrollee, and then they would get on the screen a list of the plans available in their state with a brief location description, the enrollment codes, and then the rates that they will pay. And the idea is that they'd be able to print that out. And local offices can print those out, too, to give us handouts. I seem to be missing a slide, but in addition to all of the information we have in the guide, we also have been displaying the Consumer Assessment of Healthcare Providers, the Systems CAHPS survey information. We actually already display that online as well in our online plan comparison tool, so you'll find that information if you pull up some plans. But we're going to create a new web page dedicated to the CAHPS information. And then we're also going to revise the Medicare section on our website and then make this information easier to find. So that's the plan so far. It may change, and if you have any suggestions, you can please let us know. And that's it. I guess I'll pass this on to Maria.
Thank you, Demi. Today I'm going to talk to you about the family member audit. Current practice is that family member eligibility is primarily self-certified by the enrollee at the time that he actually enrolls in the FEHB plan. Agencies and carriers both have responsibility for eligibility determinations, but right now there are really few requirements out there that you can depend on to help steer you through this. Thus, we have developed an agency priority goal for 2015. That is to prevent erroneous payments incurred in the FEHB program as a result of health claims being paid for ineligible family members. This will also help us to determine the need for an enrollment system that tracks data on all family member enrollments. This is a large initiative that we've been discussing recently within the FEHB program, is to actually have a centralized enrollment base where all dependent data will be captured. So how are we going to attain this goal? We're going to obtain a vendor to perform a family member eligibility audit on a random sampling of the FEHB. We'll use 1,000 family enrollments, which will be approximately 2,000 family members, and this will assist us here at OPM to determine if a problem actually exists. So how will this help? Well, we'll be able to develop and implement new enrollment policies to verify family members are eligible and to clarify procedures how to remove ineligible family members. If you need additional information on this or would like to talk about this or give your opinion, you can contact me. I'm Maria Bianchini, and I'm at maria.bianchini@opm.gov. Thank you very much, and now I'll turn this over to Amber Hudson, who will talk to you about Self Plus One.
Thank you, Maria. The Section 706 of the Bipartisan Budget Act in 2013 added a Self Plus One enrollment type for federal employees and retirees under the FEHB program. Employees and annuitants will have their first opportunity to select a Self Plus One enrollment type during this upcoming open season. We have released 2 benefit administration letters, one in December that gave out information on system changes, and one this past March that talked about agency responsibilities. We will continue with our normal open season series of BALs that will go out, and we will be providing additional information for you to provide to employees on Self Plus One as well. The new Self Plus One 3-digit enrollment codes will end in 3 and 6. So the codes ending in 3 will correspond to each plan's 3-digit enrollment codes that currently end in 1 and 2. And likewise, the new Self Plus One 3-digit enrollment codes that end in 6 will correspond with each year's, each plan enrollment code that currently ends in 4 and 5. So we are working closely with the electronic enrollment systems, agencies, and carriers to ensure that the system updates are accurate and complete. Here are a couple important dates that you should know as we move forward in our planning. September 1st, that is the deadline to complete the testing for all our systems. November 9th is when open season begins. And January 1st is when the Self Plus One enrollment codes will be activated. So like I just said, employees and annuitants will have their first opportunity to enroll during this open season. And the Self Plus One enrollments selected will be effective the first full pay period in January. So that will be the same as any other open season. That will not change. Now, please keep in mind that OPM nor agencies or carriers have the authority to automatically enroll employees in any enrollment type other than the court order for children, and court orders will be addressed in further guidance. So therefore, employees and annuitants will have to make a positive election during open season if they want to change their enrollment type. We will not be changing enrollments automatically. Now, the Self Plus One enrollment type covers the enrollee and one designated family member, either a spouse or a child up to age 26, or a child age 26 or over who is incapable of self-support because of a mental or physical disability that existed before age 26, is also an eligible family member. So the enrollee will be covered, but the enrollee must designate who they want their covered family member to be. So that's unlike self and family, where when you enroll in self and family, all of your eligible family members are automatically covered. With Self Plus One, you will have to designate who you want your covered family member to be. Now, our communication team is coordinating with agencies, carriers, OPM's retirement office, and others to ensure that outreach is thoroughly prepared and carried out. We have specifically prepared an extensive outreach strategy for this open season that includes webcasts, webinars, social media efforts, and mailers, and more. So therefore, we strongly encourage all benefit officers and personnel to utilize the information that we provide in the upcoming BALs, especially during open season. In addition, we also encourage agencies to communicate this information to all their employees, and that includes your employees in your field offices as well. Now let's discuss roles and responsibilities. Listed are some tasks that OPM and agencies will be preparing to accomplish as we implement Self Plus One. Agencies must update their internal materials, policies and procedures, and systems to include Self Plus One. Also, as employees submit their enrollment request, you should review their information for accuracy before processing the change. And you should be doing that anyway, but for Self Plus One from here on out, that will be especially important because you won't be able to process an enrollment request if the designated family member is not listed. Also, we have an outreach timeline. From September to October, we will be issuing our OPM materials. We'll be sending out agency emails with information regarding Self Plus One, BALs, and of course the changes for 2016, and supplemental pamphlets, postcards, and things that you can give to your employees to communicate the information about Self Plus One during open season. In November, we will start our social media campaign. We will have our Facebook page and our Twitter page. And in December, open season ends. So that will close that enrollment period. And that concludes my presentation. If you do have more information, we do have our website available at www.opm.gov/self+1. There we have FAQs, the BALs that we've released, carrier letters. And if you do have questions, for benefit officers only, not your employees, you can email self+1@opm.gov. So we'll open it up for questions. Do we have any questions in the room? Okay. Demi, do you have questions?
Yes, I have a question. Will historical premium amounts be available online? Well, we do have the historical premiums online now, but they only go back to 2013. We do have previous years as well, so if somebody needs to go back further, just send us a request and we'll send them to you.
Okay, I do have a question. The question is from Sandra. It says, will the cost be lower than self and family option? Is there information on our website that will provide information to employees before open season? Information for rates will be available the same time as it is every year, probably in September or early October. So that is when we will know what the rates are. And that information will be on our website.
Okay, so Andrea has asked me Is there any penalty for an employee currently who intentionally includes a non-eligible person on their SF 2809? And the answer to that is yes. There is both a monetary and a jail term penalty quoted on the SF 2809.
Great. Let me see. We have a couple other questions. I'm asked to clarify, as a federal employee, I am married and have a child under age 26. I assume I cannot qualify for Self Plus One for my husband and myself until my child's turned 26. So that is incorrect. Although you may have multiple eligible family members, no matter how many eligible family members you have, you may enroll in Self Plus One. You just need to designate what family member you want to be covered.
I have a question from Michelle. Could the information that replaces the guide be converted to PDF for printing? Some of the information already is in a PDF format, such as the FastFacts. As far as the plan lists by state, we're still working on that. You're going to be able to print it. I'm not sure if it'll be a PDF, but like I said, we're still working on that, but you will be able to print it.
Great. If we have another question, if an employee enrolls in Self Plus One during open season via an electronic enrollment system, how can the agency verify processing? So if you do use an electronic enrollment system to make an open season change and you want to verify the status, you can always check with your human resource office to see if that has been processed.
I have a question from Judy, who asks me, what happens if an employee has not notified the carrier of their divorce and the carrier has been paying for services for the ex-spouse? Does someone have to repay the carrier, and if so, whom? The answer to that is that in most cases, when the carrier finds that they have been paying benefits for an ineligible family member, they will go back to the providers that they paid and ask to be reimbursed those monies. And they may even go after the employee or the enrollee and ask them to reimburse any monies that were not collected from the provider.
Thank you. I believe we have a question in the audience.
Yeah, I had one question on the Self Plus One. If you have a employee with a court order for to carry children, and is only one, we used to enroll them in family if they didn't choose to make the election on their own. Can we now enroll them in Self Plus One?
Yes, guidance will be forthcoming about which enrollment type to enroll them in. So if they're eligible, it's only one child, and they are eligible for Self Plus One, then the automatic enrollment will be there. And if it is more than one child, it'll be self and family. Yes.
Yes, I was wondering, there's some carriers that are requesting information, Social Security number verifications. Now, is this part of the initiative in order to find out and verify the enrollment for family members?
I'm sorry.
Yeah, there's some carriers that are mailing out letters and verifying Social Security numbers on family members on family plans. Is this part of this initiative that's trying to identify all family members under
No.
family coverage?
No, sir, it is not. It is part of another initiative that has to do with the ACA and employee shared responsibility. Okay.
I have another question. If it says my spouse and I are seeking divorce during the next open season, can I elect Self Plus One, or do I need to wait until we are officially divorced? So open season is the time where you can make plan type changes, option changes, you can make, or cancellation. So during that time, if you would like to make an enrollment change, you may do so, and you may elect a Self Plus One enrollment type.
I have an email from Judy who asked me, how will OPM choose the enrollees to be audited? We are going to choose a random sampling from both the annuitant rolls and the current FEHB rolls.
We have another question. Does the Affordable Care Act not require us to keep the child under age 26 on our FEHB plan? There are requirements under the Affordable Care Act. However, if you, what you elect and what you choose, the enrollment type that you choose, is an individual decision for yourself. So I wouldn't be able to make that determination for you. But if you do have a enrollment and you are covering a child under age 26, they are eligible for coverage until they turn age 26, or unless you switch to a self-only plan, which would only cover yourself. We have another question in the audience.
So if a person has self and family, so that covers the spouse, the enrollee, the spouse, and the child turns 26 in the middle of the year. So now, because they're no longer eligible, do you then take them down to Self Plus One?
Well, there are no automatic enrollments. There are automatic changes that we would make. That would be a qualifying life event that you can make a change. Further guidance will be forthcoming. There are going to be qualifying life events that will allow you to switch your designated family member, and that guidance is forthcoming.
Angela has asked me, what part will the benefit officer play in the family member audit? You as the benefit officer may be asked to provide any type of verification documentation that the enrollee may have previously provided to you and is now being asked to provide to the contractor who's conducting the audit.
I was asked to clarify. I did say that agencies should review the enrollment information before accuracy, and that is due to the differences that for Self Plus One, you must designate a family member that you want to be covered. So therefore, if someone is enrolling in Self Plus One and they don't have that designated family member listed, you should review that information and give that information, give the form back to your employee, because they must designate a family member that they want to be covered. If this is done electronically, our systems are making updates, and that will be the same thing. The enrollment will not process unless they have a designated family member in the system. Have any more questions? Okay, I think
sorry.
we're going to move into our, do you have another question?
Yes, I had a question from Judy who wanted to know, when will this audit be conducted? And it will be conducted during this fiscal year.
Okay. Do you have any questions? Okay. So I think we're going to move into some general FAQs. Oh, for Self Plus One, if you have questions, again, the email is selfplus1@opm.gov. So we have received some general FAQs that we see from employees and benefit officers. So we thought it'd be good to just address a couple while we're here. Many people have asked, what's the difference between a suspension versus a cancellation? Federal employees are not eligible to suspend their coverage. If you are a retiree, there are certain circumstances in which you may be eligible to suspend your coverage. For example, if you're in a Medicare Advantage plan, you may be able to suspend your coverage, or if you have TRICARE. A cancellation is a voluntary action by an employee to cease their FEHB coverage. We also received the question of, can I cover my domestic partner? A domestic partner is not an eligible family member, and they would be ineligible for coverage under the FEHB program. Also, we received, can I remove a family member from my enrollment? The answer is no. Under a self and family plan, all family members are automatically covered, and it is not permitted to exclude eligible family members from coverage. there is no remedy to remove a family member. When the Affordable Care Act was implemented, it removed the dependency requirements from the law. So therefore, there's no requirement that a child must be dependent on you, be it financially or anything else. So that when that went away, the mechanism to be able to say, well, my child is going to college or my child has their own job was removed. So there is no mechanism to remove anyone from coverage. The only time that your family members wouldn't be covered is if you are enrolled in self-only as currently, and then if you enrolled in Self Plus One and just didn't choose that, didn't designate that family member to be covered. I do not have a local human, excuse me, I do not have a local human resources office. Who should I contact? We do have a list of headquarters benefit officers on our website. Maria, do you recall that address?
It's www.opm.gov/ABO.
Thank you. So you can visit our website, and we do have a list of headquarters benefit officers if you don't have a local human resource office. I encourage all headquarter benefit officers to make sure that your employees have that information so that when they are having problems or concerns, they can contact you. Okay, I think we have a couple more questions. Maria, how will OPM choose the enrollees to be audited?
We're going to do a random sampling, as I mentioned before. We'll take all the family enrollments of both the annuitant roles and the active employee roles and choose 1,000 employees using the same ratio as how they are enrolled in each plan.
Okay, great, thank you. I think we have another question coming in. For me, we have who can be covered under a Self Plus One enrollment. Again, our eligibility requirements have not changed, so that would be your spouse or a child up to age 26 or a child age 26 and over who is incapable of self-support.
Okay, so a question I have is, what will you do with the audit results? That's a good question. OPM will use the results to determine, one, if a problem actually exists with ineligible family members, and if so, what policies and procedures can be adopted to help to control this situation?
Thanks, Maria. We had a question regarding will our forms be updated. Our forms will be updated. That does include the SF-2809, our health benefits election form, and our website will be updated with Self Plus One information as open season nears.
Did we have another question from the floor?
Yeah, I have a question. So a lot of times, employees enroll their grandchildren under the foster grandchildren program, or under foster grandchild, and they show that they're supposed to be the children are dependent on them. So now during this audit, if you find out that the children are no longer living with that employee but are now back with their parents, is that something could come back where they're going to have to pay the people the money back?
We're still deciding exactly how we're going to handle this, if those types of disenrollments would be prospective or retro. No decision has been made on that at this time.
Thank you. Well, I thank everyone for attending and listening today. This concludes our presentation, and we look forward to speaking to you in the future. Thank you.